Welcome to Village Connector TV. My name is Glenn Garnes and I'm your host, and I want to thank you for joining us for this special segment of the show. This segment is part of our Optimum Health Club program, where we interview health and wellness experts on a variety of different topics that should be relevant to you. And today I have the pleasure of bringing into the studio Sarah Blake of Blake Psychotherapy. Sarah is going to be sharing some information with us about her practice and what she does to help you live a balanced life. So Sarah, thank you so much for joining us on Village Connector TV.
It's great to be here.
Well, let's start off by getting a little bit of information about what it is that you do, how you perceive your practice as it relates to the patients that you work with.
Well, we're here to help people, first and foremost, there's a period at the end of that sentence, help them to figure out what the things are in their lives that are tripping them up, help them to figure out how best to move forward to make changes so that they can live a life that more easily reflects what they're really looking to do.
And you know, I remember in reviewing your website that you talk about restoring balance. What does that mean for you? Well,
you know, you can look at balance as those judges' scales. A lot of times people's lives are one way or the other, and everybody's looking to kind of try to get that as even as possible. We talk about emotional balance, which has to do with being able to regulate the emotions that we feel. And what I mean by that is that we want people to be able to feel all of the emotions that might hit them. But similar to maybe riding a wave, we don't want those feelings, sadness, anger, frustration, to knock them down. We want them to be able to ride through those and be able to get to the other side where maybe they're going to feel joy and contentment.
So would it be accurate then to say that you teach your patients how, when they experience whatever the emotion may be, to return themselves to an even keel as it relates to that issue?
Absolutely.
Fantastic.
Absolutely.
Fantastic. Now, I know from personal experience and dealing with a number of different wellness professionals over the years on this show and on other things that we've done, that everyone has a different style in terms of how they choose to work with clients. In the world of therapy, psychotherapy in particular, there are certain types of styles that have developed, some of them being directive, some of them being more passive or consultative. How would you describe the way that you and your staff work with patients?
Well, everybody that comes to us is different, and so the way in which we approach working with our patients is going to be a little bit different depending on who the person is that's in front of us. We certainly each have our own styles, but the most important things that we are trying to do is make a connection with the person that's in front of us, to be able to help them to feel comfortable, to help them to feel not judged in any way, to allow them to be able to take this journey with us without there being any blocks in between you sitting there and me sitting here, so that we can work together. We work with individuals, we work with families, we work with couples, and again, each of those is going to be a little bit different in terms of how we're going to approach it.
So you don't have a specific standard format. You adjust your approach to the person that's in front of you.
That's correct. We don't believe that there's a cookie cutter approach that's going to work for everybody. We do take a number of different theories and practices and use them in ways that we feel are complementary in helping a person. So we may be more directive with some people and utilize some skills like dialectical behavioral therapy.
What do you mean by that?
Well, that is a way in which people learn basically coping skills through different sections. They learn about how to be mindful and use mindfulness techniques to help them ride through those emotions that we talked about earlier. We work with them on emotion regulation, which is being able to take the emotions as they come and let them be without them, again, taking over, knocking that person down. We help them with interpersonal skills, being able to sit down with somebody, ask them what they need in a way that another person is going to be able to hear them. So it's almost, DBT is almost like a class, which is much different than some of the other techniques that we use, but it's extremely effective. And we incorporate that with just talking with our clients and getting a sense of what they need. We incorporate that with cognitive behavioral therapy, which is dealing with a person's thoughts and also the behaviors that they exhibit and being able to make changes to help them get to be that person that they want to be, just for a couple of examples.
So the way you just described that, it sounds like therapy is actually more about learning skills that allow you to address life's challenges.
Absolutely, that is the way that we see it.
The reason I mention it that way is because a lot of people have some reticence about seeking out therapists. They feel that there's a stigma associated with it. There's something wrong with you that's different from everyone else. But what you're really talking about is enhancing people's ability through training and education to address life's issues.
That is correct. Some of therapy is about the therapist hearing what their client is putting out there and maybe helping them see some things that they didn't see previously, and then taking those things along with the things that they came in to see us for, like depression or anxiety or addiction, and giving them the skills that they need to handle that and to move forward with life in a way that is much more pleasing to them.
So just in the context, I'm going to use this and then we're going to move on to another topic, but in the context of addiction, for example, that's usually a situation where someone has used chemical dependence to mask or to be a crutch for something else that's going on in their lives. You're simply teaching them how to substitute something more healthy for what they've chosen.
That is correct. That, along with maybe getting a sense of what it is that led them to that place, so that history does not have to repeat itself.
Fantastic, fantastic. Well, you're taking all the intimidation out of seeking out help. And I think that's important because I think that a lot of people are not seeking out the help that they need because of what it means from an emotional or a societal perspective for people to know that they're in need of help. And there's really no reason for them to hesitate to get help in that context any more than they would if they needed an operation or treatment for a cold.
That's absolutely correct. And we really see it as a step of strength for that person to recognize that maybe reaching out to somebody else is going to help them to be a better person. So we encourage people to even just give us a call and talk to us to see that we're just a human being just like they are, and that actually we provide kind of a comfortable environment for people to take an hour and just talk about themselves, which is something you don't get very often in this life.
Wow, well, I can see that being a real value. Let's talk a little bit about your credentials and the credentials of your team members. Why don't we start with you? Tell us a little bit about your credentials academically, and then how long you've been in business.
Sure. I got my undergraduate degree from the University of Maryland at College Park, a bachelor's in psychology, and then I moved on to the University of Pennsylvania to get my master's in social work. I have been practicing for over 20 years. I've worked in a number of different settings to get a lot of experience that then allowed me to open up Blake Psychotherapy, which actually started under another name. It was under my name over 6 years ago now.
Fantastic, fantastic. Now, you have other team members that work with you because your expertise is as a licensed clinical social worker. You have other services and other things that you do. Tell us about some of your other team members.
Sure. Dr. Sharon Cannon, who is a psychologist and generally just goes by Sharon, got her undergraduate degree from the University of Miami in Ohio, also in psychology. And then she went to the University of Nebraska to get her master's degree and her doctorate. She has been in the field a couple years longer than I have, and also has a lot of diverse experience to be able to bring her to this place where she can take on whatever people kind of hand to her when they walk in the door. We also have Stacy Rempert, who is a licensed clinical social worker as well. She got her undergraduate degree from the College of St. Mary, and then she went on to get her Master's of Social Work from the University of Maryland, and also has worked in all sorts of different settings. She specialized a lot in addiction and trauma as she went along and got additional training. And then finally, we have Yevgenia, who goes by Jenny, who is our dietitian nutritionist. And she got her undergraduate degree, from Clayton College, which I believe is in Birmingham, Alabama. And then she moved on to get her master's degree in in nutrition and dietetics at the University of Maryland.
Do you want to blank on that one?
It's Maryland Integrative University, and also has her certification in nutrition and a license in nutrition and dietetics.
So you've got a dietitian and a nutritionist,
Yes.
you've got a psychologist,
Yes.
and you've got 2 licensed clinical social workers that form a team.
Yes.
And you have the ability not just to work individually in that context, but you also roundtable the different cases so that you're bringing everyone's expertise to the table on behalf of patients. Is that right?
That is correct. We feel that a team approach is often the most helpful. Sometimes I might not see something that's maybe right in front of me, but somebody else can see it looking at it from a different angle. Having Jenny on board also brings a whole new perspective to what we do, because she's able to look even more holistically than we are to maybe what's going on with a person from inside their body and what they're putting into their body, and what they can put into their body, which we haven't had until recently and we really value.
Well, it sounds like a complete approach to wellness, and now I can understand how balance can be quickly maintained and restored by having a team approach to what you're doing. Let's talk a little bit now about some of the people that you work with. You mentioned that you work with families, you work with individuals. Let's talk a little bit more about what you do for those individuals. You work with children?
You generally ages 9 and above,
Okay.
And all the way up to geriatric. So regardless of where a person is in their life, there's somebody in our office who can help them.
Can you give me an example of some of the types of services that you would offer children 9 and up?
Sure. We don't do play therapy, but we do work with those kids in some more creative ways, through movement, through drawing, through exercises, as well as talking to them to help them draw out what is going on, and help them to feel more comfortable. And we'll work with kids on issues from school issues, bullying, ADHD, up to family issues, parents splitting up, difficulties with a sibling. So it's pretty well rounded in terms of what we can do for them.
Now, I think I saw a reference to the fact that you also help with eating disorders.
That is correct.
Is that something that's done at that nine and up level, or I'm calling the 9-year-olds the children? So
Okay.
Is
Fair
that
enough.
something that you offer at that level?
We do, yes. Unfortunately, kids that young are now coming in with eating disorders. And so from that age into adolescence and then adulthood, we provide eating disorder services. Actually, about 50% of the clients that we see end up coming in with some kind of eating issue.
Now, adolescence is another group that you work with. You mentioned that just now. Tell us a little bit about some of the issues facing adolescents that you are able to assist with.
We look at adolescence from the time someone gets into their teens until 26. Now, we may cut that for this interview to do adolescents and then young adults, but an individual's brain is still developing until they hit 26. So some of the services that we're going to provide a younger teen and a young adult may overlap. For adolescents, a lot of individuals are coming in with eating disorders, with depression and anxiety, with addiction, with lack of focus or concerns about how to deal with stress. And so we'll do a variety of different things. We'll use DBT, like I talked about before, a couple of other therapeutic approaches, like acceptance and commitment therapy, where we help people to really, what it sounds like, to accept what it is that's going on with them, to figure out what their values are and whether or not they want things to remain in that same place, and if not, to move into a different area in their lives and change how they're dealing with the things that are coming their way.
I suppose that's a big part of therapy, is someone has to be interested in making the change, otherwise you're not able to do much for them, nor is anyone else.
Unfortunately, that's true. We do sometimes get adolescents who are brought in by parents who are not initially real happy about being there. With some of those teenagers, we are able to make a better connection that allows them to kind of overcome that stigma you were talking about before, the concern of what their friends will think, and that will allow them to relax and gain benefit from therapy. Sometimes they have to take a break, maybe get a little older, and come back to us when they're in a different space and more interested in what we have to offer. It just really depends on the person and what they're dealing with.
So tell me a little bit about some of the services that you offer adults, men and women.
Well, and you mentioned men and women, and we see both male and female adolescents and children as well. A lot of our adults are coming in to deal with issues of their emotions. Again, that depression and anxiety, we'll work with them on how to gain balance there. We work with issues around occupation, both in terms of maybe changing occupation or dealing with a job that maybe isn't what they really want to be in, but it's what they need to be in right then, or interpersonal issues on the job. And we will work on relationship issues. And then, the eating disorders that we talked about before, the addictions we talked about before. We see individuals with Asperger's and work with them on their peer interactions and some of the other specific things that an individual with Asperger's might be wanting to check in with someone about and maybe make different. We really, over the years, I am an eating disorder specialist from the early parts of my career, but eating disorders are, as we had talked about previously, they're a symptom of something that, is probably going on underneath. And over the years, I've seen just about everything you can think of along with that eating disorder. So the longer we've been in business, the more our eyes have been open and our training has been expanded to include all sorts of different issues that people would come in with.
Sounds like a very comprehensive offering of solutions, being very solution-oriented, and basically helping to empower people to address challenges that they face in life. Tell me a little bit about what you would give advice-wise to someone who's thinking about working with a therapist. What would be the best way for them to make sure that the relationship with their therapist is a healthy and productive one?
Well, let me start here. Every person you meet on the street is not going to end up being your friend. And every doctor's office that you go into or therapist's office that you go into isn't definitely going to be the match that you need. So one of the things that I really encourage people to do is to therapist shop. And that sounds a little silly. We don't shop for a therapist, we shop at the mall. But you can go and meet with different people to try and figure out who is that best fit. From there, once you feel like you found somebody that you feel comfortable with, you want to make sure that you're not just sitting there with that person and shooting the breeze. If there are not goals for the sessions that you're having, if you're not finding that you're moving forward, first off, I would say to talk with that person and express to them that you don't feel like you're getting what you need, because a therapist is very open to all sorts of feedback from their clients. They tend to have very thick skin and can kind of take whatever comes their way and hopefully be able to use that to better adapt what they're doing to help that person more. If that is not something that is helping to change things, it's time to move on. This is an important relationship, and it's important that that relationship fits. At Blake Psychotherapy, because we believe so strongly in this therapist shopping, we welcome people to come in and check us out. And if we're not a good fit, A, we have multiple different providers, so you can always see somebody else in our office. But if not, we're going to help you find somebody who's going to be that right fit, because we want everybody to get the help that they need.
So what I hear you saying is people who are thinking about reaching out for therapy shouldn't hesitate to find the right fit. They should look for someone who's going to be a good listener, someone who's helping them to move forward, and someone they're comfortable opening up with. And that, I guess, comes from how good a listener you would be as a therapist.
Certainly. And you'd also want someone who has a non-judgmental status. Anything that somebody throws out to that therapist should be able to take in without any kind of judgment, without throwing anything back that makes that person feel uncomfortable. If they do, again, you might be in the wrong place. You might want to say something to that therapist. We're all human. But you really want somebody who's going to accept you for who you are and be able to help you to be the best you that you can be.
You want someone on your team, not someone that's going to judge you from afar.
That is correct.
Nice, nice. All right, so what do people need to do to get connected to you? Where can they find you?
Well, there's lots of ways that a person can get connected with us. First of all, they can go to our website, lifeinbalance.org, and check us out so that they can get a sense of who we are. From that website, you can click a button, make a phone call to us. You can send an email. You can send an email directly at sblake@blakepsychotherapy.com, and I'll be able to direct you to where you need to go. Or you can call us at 410-988-4002. And if you're a first-time caller, hit 1, you'll get my voicemail. And again, I'll make sure you get connected to the right person.
Fantastic. So that all starts with going to the website, which you said was www.alifeinbalance.org.
Yes.
And from there, they can get the telephone number, they can get the email address, they can use the contact form on the website. All of those are ways that they can reach out and get connected to you.
That's correct. They can even find us on Facebook and on Twitter.
Fantastic. Well, Sarah, thank you so much for joining us today on Village Connector TV, our Optimum Health Club segment. I'm really looking forward to seeing more people take advantage of what you have to offer, because it sounds to me like you've got a very healthy approach to helping people address life's challenges. And that's what psychotherapy is all about, learning how to address life's challenges in a healthy way. So on behalf of Sarah Blake and Blake Psychotherapy, this is Glenn Garnes with Village Connector TV, thanking you for joining us on this episode.